Personal alarm systems can give you and your family peace of mind. They let you summon assistance immediately in the event of an emergency. When deciding on an alarm system, it's important to consider what services are available and who will respond when you press the help button. Some systems send alerts to your family members, a friend, or a neighbor. This option relies on your nominated contacts being available and able to respond at the time you need help, day or night. Others use a 24-hour monitoring center, so there's always someone available to respond. A key point of difference with a monitored service from INS is that our emergency response center is staffed by qualified nurses and other healthcare professionals. Their qualifications and clinical knowledge are far greater than the first aid attendants commonly used in the industry. And with INS LifeGuard, you can use your alarm system to request assistance whenever you need it, even if it's not an emergency. INS also offers many optional extras that can be added at any time to enhance the system, which is especially useful for those who live alone or who, due to mobility issues or medical conditions, might need more assistance to remain living at home. These optional products and services work seamlessly together to form the LifeGuard ecosystem. To help determine which options might be best for you, let's take a look at two people with very different needs. Meet John and Sally. John lives alone, and while he has a few health issues, he can still do most things for himself. But his family lives rather far away, so he wants to be sure he can get help promptly if he needs it. He's very active and enjoys getting out and about in the community, so he needs a system that works even when he's away from home. John chose the LifeGuard Smart Home IP Dialer, which is an in-home system that comes with a transmitter he can wear either as a pendant or on the wrist like a watch. INS also supplied him with smoke alarms that communicate with his alarm system. On detecting smoke, they immediately alert INS LifeGuard's Emergency Response Center, who will take action right away.
Mr. Cooper, this is Stanley from INS LifeGuard. We've received an alarm from your smoke detector. Is there a fire?
John also chose the LifeGuard Smart Mobile, so he can take his alarm system with him whenever he leaves home. The Smart Mobile comes with a smart dock for easy wireless charging and enhanced audio quality. John likes that he can always add other options should his needs change in the future. Sally suffers from limited mobility, diabetes, and unstable blood pressure. She wants to remain in her own home, but her family worries about her living safely on her own, especially since she's had a fall before. Her daughter lives nearby but works full-time and is raising her own children, so she can't check on Sally as often as she'd like to. Sally's family wants to know she can get help if she needs it, but they also want to be sure Sally is monitoring her health. They'd like Sally to be able to speak with a nurse or GP without leaving home, as it's difficult for her to travel. After speaking with the friendly staff at INS LifeGuard, they decided on the LifeGuard Smart Home IP Dialer. Much more than a personal alarm, the IPD is a medical alarm system with built-in telehealth and social networking capabilities. That means Sally can use our free telehealth service, which allows her to regularly record her vital signs, either wirelessly using our range of monitors or manually using her existing equipment. With this service, her family can monitor the results whenever they like, using our secure web-based client portal or our LifeGuard Smart Carer app, absolutely free. They could also choose to use our professional telehealth monitoring by a registered nurse. If the readings are ever of concern, our nurse will follow up to make sure Sally is okay. This service also includes a free monthly review with a registered nurse scheduled at a time that suits Sally. At the appointed time, our nurse will initiate an audio-video call with Sally to discuss her health issues, review her previous month's data, and, if Sally likes, forward a report to her medical practitioner. Sally added our optional GP consult service, which allows her to schedule audio-video consultations with a GP via her IP dialer, allowing her to have a virtual face-to-face GP consultation without leaving home. She can even receive low-level pharmacy scripts. The Smart Home IP Dialer comes with a standard wrist or pendant transmitter, but Sally's family opted to swap it for a fall sensor, so if she were to have another fall, an alarm could still be triggered even if Sally couldn't press her help button. Lastly, because it can be difficult for Sally to move about the home, her family wanted to be sure she could access the system from other locations. This can be done by adding additional call points or the Smart Home Mate, a clever companion that extends the functionality of the IP dialer to other rooms. It's compatible with Google Assistant, so if Sally couldn't press her help button for any reason, she could still trigger an alarm via voice command. Sally and her family feel better knowing she can remain in her own home and manage her health better with the help of INS LifeGuard. For those who desire a higher level of support, including those with dementia and other cognitive disorders, we have other options to help ensure their safety. For example, our activity and safety monitoring service uses one or more low-cost infrared PIR motion detectors to passively monitor a user's surroundings based on preset criteria and report back to family or carers who can check on the person. Our LifeGuard smartwatch is a mobile alarm option featuring GPS location tracking in the event you need to locate the user. Exit and seizure sensors can trigger alarms when the person steps on a mat, as when exiting the bed or room, or when feet on the mat are absent, such as when exiting a chair. We even have an underbed sensor that can detect epileptic seizures and trigger an audible alarm, in addition to alerting a nurse in our emergency response center. For those who may be unable to press a standard transmitter button, we can provide a special transmitter with a tube the person can breathe into when they require assistance. And anyone could benefit from our home automation and security service. This lets you use your smart home IP dialer to automate various tasks and monitor outside the home. For example, you can use the IPD to turn lights and appliances on or off remotely. You can also connect monitored infrared PIR beams, which provide security by monitoring movement in and around the home. All our products and services work seamlessly together to form the LifeGuard ecosystem. Rest assured, we're always improving and adding to our service offering to ensure we provide the very best support to you and your loved ones. Give us a call and let us help you choose the products that are right for you and your loved ones. Call 1-800-636-040 or visit theinsgroup.com.au.